introduce Gisli from Iceland, who takes LDN. Welcome, Gisli.
Thank you, Linda.
Could you explain your condition?
Well, I do have ME. What is called Myalgic Encephalomyelitis, and more commonly known as chronic fatigue syndrome.
Okay. How long ago was it when you started to suffer with this condition?
I have had it since I was about 10 years old, although I didn't recognize it as such until much later. Probably about 25 years old, I realized something serious was wrong. Yes, and that's about 20 years ago now. I'm 45 today.
Okay. So, have you been offered any medication or anything?
Apart from LDN, you mean?
Yes, before the LDN.
Yes, I did try all kinds of medicine intended to treat depression. And mood swings medicine like lithium, and stuff like that. The thing was, I was first diagnosed as depressive. That's very common with ME patients, that they get the wrong diagnosis in the beginning.
Yes.
Yeah, and the vast majority of us are diagnosed as depressed. Yeah.
And what symptoms did you experience before LDN?
Pardon?
What symptoms did you have before you started LDN?
Well, my condition got to the point about 3 years ago now that I was in critical condition. It was after I had a normal flu. My illness got dramatically worse. It got to what is called the third stage of progression of this disease. And I was more or less paralyzed in bed for 1.5 years.
Oh dear.
And it was really awful situation. So many symptoms that I could mention. I did have. I was losing my ability to talk because of difficult brain fog. There was very hard for me to form sentences. And it was I could hardly read text, for example.
Yes.
And I was having what is called post-exceptional malice. That is the hallmark of ME. Whatever I did, it meant that I was in bed afterwards.
Right.
Any kind of work or just mild exertion was kind of just got me straight into bed afterwards. Yeah, I was glued to my bed.
I understand. And how did you hear about LDN?
I started searching for alternative solutions on the internet, basically because I didn't get any help from doctors. This condition is very undertreated in our medical system, and basically in all the Western countries' medical system, it's hardly recognized and treated. So I realized I was on my own, really. I started searching on patients groups on the internet what all the patients had found and what had helped them.
Mm-hmm.
And I found this Finnish woman, Maija Haavisto.
Yes.
Yeah, and she was talking about that it was really possible to treat ME with LDN in many cases.
Mm-hmm.
And I just kept on Googling and searching, and I saw that there were quite a few instances of that this was the case. I could see that there were many patients that had with my condition that had help from LDN.
Okay. So how did you manage to get a prescription for LDN?
Well, I was quite lucky. I went to my general practitioner,
Mm-hmm.
and I told him of this medicine I had heard about, and I gave him printed out a few articles for him, and an article from Stanford University, among others, the fibromyalgia research from Stanford.
Yes.
And he agreed. He knew my situation that was in a very bad condition, and just agreed to do it.
Oh, that was wonderful.
Yeah.
So when you started, did you start on a very low dose?
Yes, I did. I started like 1.5 milligram. I was, as I remember, I think it was for 3 months, 1.5 milligram.
Mm-hmm. Did you notice any side effects when you started?
Yes, when I started, there were like I think it was like 12 days, something like that. That I just slept and slept. I think I slept for 18 hours.
Goodness.
For the first 12 days, there were really powerful effects from it, and I think this was just my body responding in a positive way, because I had not been able to sleep properly for this 1.5 years, except for very short periods of time and very unregulated sleep.
Mm-hmm.
So I think this was just my body responding positively to LDN.
And how long did it take before you started to notice positive effects?
Pardon?
When you first started, how long did it take before you noticed improvements in your symptoms?
Well, it was kind of dramatic for me. The onset of the good effects. It was on the 4th day, and my brain fog started to lift, and I started to be able to concentrate. I felt much better.
Mm-hmm.
I could really feel that the endorphins were starting to enter my system.
Yes.
Yes, and it was I really just it really just made me cry a lot. I felt I had a chance to live again. I had been in a really critical condition, and I just called my people and everybody, and quite a few friends, and told them it's really working, and I couldn't keep the tears from running. It's really dramatic for me.
Yeah.
Yeah.
And what would you say to other people who want to try LDN?
Well, I since this happened, I've been writing about it on patient groups and online resources where I can reach people, and I'm just trying to get as many as I can to know about this medicine. I just say, just try it. You know, it's you got nothing to lose. It's and everything to win. There's so much healing from this medicine. It's incredible. If it's working, I've seen it in many cases that it doesn't seem to help everybody, but those who it does help. It's just great.
Mm-hmm.
It does a wonderful job.
Well, thank you very much for sharing your experience with us.
Yeah, my pleasure. Yeah, my pleasure.